Okay, so today we're going to start an IV. So the first thing we need to do is make sure that we're starting the IV on the right patient. Make sure we have the proper size gauge needle. For this I'm going to use the 22 gauge. So I need to start by making sure I have everything ready. I'm going to open my IV start kit. Make sure I keep a sterile area because I don't want to contaminate anything. Okay. Okay. I'm going to open my saline flush. I'm going to put my clave on so it's ready to go once I've started the IV. I'm going to go ahead and prime that to make sure there's no air bubbles in there. Okay. So we're going to open our needle. Maybe we're going to open our needle, gosh. Okay. I'm also going to tear some tape right now, so when it's time to tape the IV down, I'm going to be, or I know I have tape to do that with. And I'm just going to stick that right here for when it's ready. Okay, so the first thing I'm going to do is go ahead and tie a tourniquet around my person so I can find a good vein. Okay, I'm going to find a vein and decide where I'm going to start. I think I'm going to start right here. So I'm going to clean it off with an alcohol swab or this ChloraPrep thing. First I'm going to go up and down, then side to side, and then in a circle to make sure the area is really clean. Then we wait for it to dry. Okay, I'm also going to clean off my glove so I can feel for the vein one more time. Okay, so once that's dry, I'm going to go ahead and uncap my needle. I'm going to find my vein, make sure I'm ready to put them in the correct spot. Okay, then with the bevel up, I'm going to go ahead and insert my needle. If the catheter would stay back, that would be awesome. Okay. And I'm going to look for my flash, which I have. So I'm going to hold pressure. I'm going to pop my tourniquet and go ahead and push the catheter into the vein. I'm going to hold pressure so he doesn't bleed out. I'm going to go ahead and hold this. Oh no, that just fell. I'm going to go ahead and attach my saline flush. Okay. I'm going to flash back to make sure I have blood, which I do. And then go ahead and flush it. Okay. I'm going to detach this. Now I have a closed system, so it's not a huge deal to keep pressure right there. I'm going to go ahead and tape it. Okay. And then I'm going to pretend like this didn't fall on the floor. It's sterile. And we're going to take this off. I'm going to lay it right above the IV line and make sure that my patient stays still. Make sure that doesn't move. I'm going to peel off the white edges. Okay, and then I'm going to peel off this little sticky thing. I'm going to initial it and write the patient's, or write the date that it has started and the size of the needle. And we've started an IV.